Hello, my name is Jim Weber. This video is derived from a hands-on wet lab seminar that was hosted by Cornell University and the University of Maine for a group of goat breeders who wanted to learn more about how to do artificial insemination using frozen semen on their farms. I'm a veterinarian at the University of Maine. I also have a background in reproductive physiology of small ruminants. So basically I got involved in this course in terms of teaching to these people. We spent a weekend actually going through slide presentations and then going in and breeding goats and talking about all the different moving parts that had to do with artificial insemination. This particular video is a critical video, in my opinion, because it actually shows the mechanics of physically putting the insemination pipette inserting it into the goat and passing it into the cervix. We call it the mechanics of goat artificial insemination. And this was a combined effort of work and images and different types of input from the participants or the folks who ran this, myself, Betsy Hodge, Tatiana Stanton of Cornell University, both of them, and Renee DeLue, who's a dairy goat breeder. So anyway, another person I want to thank for this is Diana Walters, who was taking lots and lots of pictures with her cell phone and was nice enough to contribute these to us for use in some of these. And these are some of the best photos we had actually of what it actually looks like when you're peering through a speculum into the doe's cervix. Okay, there's several other videos that we're putting together, and they'll all be, up on the webpage. This might be one of the later ones you want to watch. Go back and watch some of these other videos which talk about anatomy and how we get these goats to synchronize and different things like that. And I think they would be helpful to look at before you actually do this one, because this goes right through and shows you sort of the end product, what you're building up with. So first thing is again, when I work with people who are trying to do cervical, non-surgical cervical insemination of goats, I think the most difficult thing that they have to do is to actually figure out how to pass a pipette, when they're kind of bent over and the goat is moving and the lighting isn't very good, and actually be able to recognize what the cervix looks like and where to place the pipette and exactly what to do. So short of having someone, over your shoulder showing you like we did at this wet lab, this is hopefully the next best thing, the videos and the pictures that I'll be showing you. The second thing that I think is just as important is, if you've listened to some of the other videos, I've talked about the fact that we can synchronize a doe with drugs, like cedars and things like that, to cause them to ovulate on a particular day, for example, but we can't fine tune it to within hours. So when we put semen in, we really want to put it in just a few hours before that animal ovulates. And one of the things that we assess during the day when we know the goat is in heat and she's ready to be bred will basically delay the breeding until something called cervical mucus is just right, okay? And these pictures actually show cervical mucus at several different points during that progression, from being too early to this is the perfect time to breed this goat to maybe a little bit late. And so I'll point that out as I go through and show you some of these pictures of the cervix, because most of them, you can see the cervix, you can see the cervical opening or ostium, and you can also see cervical mucus. Generally, what we look at when we breed a goat is early in estrus, prior to the time when we're ready to breed the animal. The goat is starting to produce a very clear, sort of soupy, very watery mucus, okay? That's too early to breed if you see that. As we wait a few more hours on the same goat, maybe we go in every hour or two with the speculum and we look, that mucus is going to become a little bit more thick, and it's still going to be runny, but it's going to start getting cloudy, okay? And that is really when we start getting cloudy, thicker mucus, we're ready to breed that goat. That's the perfect timing. It's going to vary depending on goats. So the day of artificial insemination, you're going in, you're specking lots of goats. You're saying, okay, that one's got to wait a little more. This one's ready to go. And it's a very busy day, so you're going to need several people helping you with this. If you wait too long, the cervical mucus actually becomes not just cloudy, but white, and it becomes kind of sticky and hard. Okay, so instead of being a liquid, it becomes much more viscous. And at that point, if you've got, you may still breed, but you're probably getting on the late side. And in those cases, your pregnancy rates are going to start to drop. So luckily, this happens over the course of a number of hours. So ideally, you can figure this out. My recommendation is the first time that you go in and you artificially inseminate a group of goats, don't synchronize too many at one time. You really want to spend some time learning, the timing of your particular goat herd and what happens during the day and how you're going to figure all this stuff out. Maybe do 2 or 3 goats in a day. All right, so again, familiarity with the anatomical structures within the goat, the internal reproductive structures that we can see will make you more proficient. There's another presentation that I gave that actually goes into that in quite a bit of detail, so you want to see that first. So let's say you're getting ready to do an insemination in 2 weeks. Okay, you're doing the synchronization, and your insemination should be planned for 2 weeks from today. You want to make sure you have a restraint system where you can, take goats that are loose in a pen and easily get them into some sort of a runway, run them into a chute, and have that goat. Hopefully, the goat is climbed up a little bit so it's not at ground level. Maybe it, so the back end of the goat is at about shoulder level for you. So you don't have to bend way over to actually insert the speculum and things. So the goats have to get used to this, okay? I would suggest that well before you actually need to AI, you want to put some goats into your restraint system. You want to get some speculums, lube them up, maybe feed the goats some grain, and actually put the speculums in and start looking around and seeing whether you can identify the cervix. It really doesn't matter what stage of the cycle these goats are in at that point. They'll probably be more cooperative if they're in estrus. So once you do this, you then start becoming familiar with, that particular speculum, that particular light source. There's different size speculums, so you figure out that's the speculum you need for your particular breed and age of goat. And you see whether or not you can get a good look at the cervical opening. And if it doesn't work with one particular brand of speculum, you may want to go out and buy another one. Talk to people who've done this before. Try to get other people there so they can point and show you what you need to say. So not only does this train you, it gets your goats ready to used to your restraint system and being handled basically, and the speculum being passed. And this will make things much, much easier when you go in and do the AI. The thing about artificial insemination is you're going to thaw out a straw of semen. And once that semen has been thawed, the clock starts running. You have just a few minutes to get that into the goat. So you can't spend 30 minutes trying to figure out what you're doing and passing the catheter. The semen will be no good at that point. So you've got to be good at it. And the goats have to be quiet. So get a good restraint system, get the goats used to it, and practice, practice, practice. I found that having a bucket of grain and somebody dribbling grain into the front of the bucket, on the front end of the goat while you're working on the back end really works. It's a great positive reinforcement for them. And again, don't use one goat all day. Try it with a bunch of different goats so nobody gets too stressed out. All right, so before you breed the doe, again, do some dry runs. Observe your goats for standing heat. So again, what we're looking at here is, what is a goat that's in standing heat? We'll talk about that in another video. Basically, we've got some good videos of goats. They basically change their behavior. If you bring a buck along outside of a pen, the goats will come over to them. There's other ways where we actually use what's called a vasectomized buck, and we let him run around loose, and he's actually breeding does, and you can tell which ones are standing form and which ones aren't. So again, one thing you need in these cases, you need a good way to identify your goat. Small herds, you may be able to identify them just by what they look like, but generally you need a good tag system with very visible, clean tags. So make sure all that's in place. On the day that you're breeding the does, you want to make sure that you've got a nice clean area. I tend to have clean the tables off, put down clean paper towels on it over everything. Make sure the room is at room temperature if it's a cold day, and make sure that everything is ready. Everything is laid out and you know where everything is. Catch and restrain your goat, bring it up into the elevated chute. And before you breed the doe, maybe early in the day, you start monitoring your goat's cervical mucus. And you're looking at that progression from clear to cloudy and from watery to slightly more viscous for the insemination. Once you get to that point, you decide to inseminate, you load your insemination gun. And there's a separate video at the bottom here that will show you. And then you basically thaw out the semen, you load the gun. In most cases, we wrap the gun in clean paper towels. If it's cold out, we'll actually find a nice warm thing. You'll be wearing a jacket. You'll put it, inside your shirt or something like that to keep it warm and make sure you don't get what's called cold shock. So at this point, definitely you need an assistant to keep the goat quiet, hand you things like that. You're then going to go in and you're going to take a clear plastic speculum. You're going to lube it. You're going to insert it into the goat's vagina gently until it stops. And you're going to turn on a light source so that you can see what's going on in there. So organization in this case and having trained help is really helpful at this point. Generally, when we put the speculum in, we start off, the speculum is actually going a little bit uphill into the goat, and then we sort of have to straighten it out to get it all the way down. So first thing I would do is put the speculum partway into the vagina, not all the way down to the cervix, turn on the light source and start looking around and seeing whether way down past the end of the speculum, we're seeing the cervical opening. Once we identify the cervix, we then know sort of how far we have to advance the speculum to get basically so that the speculum covers the cervix. If you think about it, it kind of goes like that, goes over the end of the cervix. So what does this look like? All right. So in this case, what we have is we have a clear speculum, and you can see the outer wall of the speculum right here. This is basically the end of the speculum. So the speculum is going back here, and it's up on this side. We can kind of see the speculum shining, little shiny edges, and that's where the end of the speculum is. So it's pushed up against what's called the cranial vagina, and within that area, we've captured the cervix. So all of a sudden, we've got this little bump here that's coming towards us. If this was a 3D picture, that would be protruding toward us like a little hill. And that is actually the cervix. It's kind of a little bit darker, uneven pink color. We can see here that there's a lot of white stuff around this. This is all cervical mucus. Again, I talked about the type of cervical mucus. Would you call this clear, cloudy, or white? Again, in this case, I would say this is white, fairly well stuck together mucus. I would almost call it tacky at this point. And this is a goat that we probably waited too long to actually breed. Okay, and I don't know, during the short course, I don't know whether this goat got bred or not, but chances are that we didn't get a pregnancy on this one. If you look toward the middle here, there's actually kind of a spot, it's a little bit shiny, but that's actually the cervical opening or ostium. So light sources here, we see the cervix, we've got our speculum in place. The next step would actually be to go in and pass a pipette. This is showing another cervix kind of from not quite as close up, so maybe from the outside of the animal. And this is really what you would probably be seeing if you were visualizing this from the outside of the doe. Her tail's up, you're looking through the speculum, and you're seeing these structures. But again, that's a good picture of a cervix, and it's also a good picture of some late stage cervical mucus. Again, cervical opening is a really good picture. Again, showing the light source, which is sort of stuck to the side of the inside of the speculum. We can see the speculum wall right here. The pink on the other side of the speculum is the vaginal wall. And you're getting way down at the end here. We're getting a very good view of a cervix and a very clear cervical opening right here. Okay. The light source is right here. And what we've basically done is we've trapped the cervix in the circular end of that cylinder that's the speculum. Here's a little bit of a closer view of this same cervix. And what I want you to look at again is the opening. So basically what you would do at this point if you were putting the insemination pipette in is you would slide it down the speculum and you try to aim for that opening, and you would very gently advance it into that opening. And I tend to twirl it a little bit, move it a little bit, and basically gently try to advance it a few centimeters into that opening, as far as it'll go without any sort of pressure or, chance of damaging tissue. You're very gentle and you kind of advance it. Now, what do you think about the cervical mucus on this one? Again, what we're seeing is a little bit of cloudiness. On the edges of this, it's a little bit thinner. It's a little more transparent. I would call this very close to where we want to be in terms of breeding. We've got cloudy mucus. It hasn't really become dry yet. It's still pretty, basically, it's got a lot of liquid left in it. And so this is actually pretty close to what you want to see in terms of breeding. This again, very late stage cervix. This one's a little bit over, the picture's a little overexposed, but you can still see the cervix here, cervical openings in the middle. In this case, we've almost got cottage cheese consistency mucus. And this is again, a little bit later in the estrus period, probably too late. Here's your light source, here's your speculum, and you can really see all these things, kind of what it would look like. The trick with these, and in most cases, is being able to focus at this distance, okay? All you young people, you probably don't understand what I'm saying, but the older folks will understand. Here's a really early stage cervix. Again, cervix is right here, cervical opening is right there. You'll notice there's actually, you almost can't see it in this. You'd see it better if you were looking in here. It almost looks like there's water kind of pooled up at the bottom here, right below the cervix. And that's cervical mucus. It's fairly watery. It's still more mucusy than watery if you actually, went and got a sample of it. But there's absolutely no cloudiness here. So if I saw this in a goat on a morning, the day we were going to breed, I'd say I'm going to come back in an hour or two and look at her again and see if this has changed any. Okay, so gives you kind of a good idea of what's going on there. Another one, this is another close-up. I just keep showing different ones. This is showing one, we're getting a little bit of cloudiness in the cervix. Again, it's almost clear, but it's starting to cloud up a little bit. We're going to see we're getting closer to that period where we want to be. Again, it might be hard to see. This is really kind of what you're going to see. Some of the other ones were close-ups where we use the zoom function on the camera. This is really what you're going to see when you're looking through the speculum. You're going to be way out here, and you're going to be looking at the cervix way down. You can see the opening. Maybe you can see some cloudy mucus down here on the bottom is what I'm seeing. So she's at the correct stage also. So here we've got an artificial insemination pipette that's going in. And you can see the pipette, you can see the opening. This is a better view of that same one. So here's the pipette. This is actually the plunger on the end of the pipette that you're going to push with your thumb later on. Okay, so your eye is right next to that, and you're running it down the speculum, and somewhere in here is the opening of the cervical ostium, and you're trying to get this tip. And again, remember, this is a metal cylinder that's got a nice, smooth, soft plastic cover over it with a little tiny opening in the end of it. So it's actually a pretty good pipette to put into the cervix. It's small, it's easy to manipulate, but you've got to get it started. And you certainly, you want to make sure you stay in that center area, because you can also get around the edge of the cervix, and between the folds of the cervix, you may think that's an opening, but it's not going to go anywhere. So anyway, I hope that gives you a little bit of an idea of how this is going to work for you. Again, there's no substitute for practice and experience. And the two things I say is practice during earlier estrus cycles, earlier in the breeding season, and find somebody who's done this before to help you, to be there when you're actually looking at the goats. The pictures will help to get you started, but you really need that. This is actually the point. We're going to clip in a video with Betsy Hodge, actually, a large scale video showing Betsy breeding a goat, to give you some idea of handling and what we do and that part of the procedure. So I'm going to end here, and we're going to clip that onto the end of this video. Thank you.
Hello, my name is Betsy Hodge. I'm the livestock educator in St. Lawrence County, which is in northern New York. And I help put together the workshop for these Goat AI videos. And I'm going to show you a few clips from our workshop. First, I'm going to start by giving you a few reminders. Before you breed your doe, make sure you line up some help. Do a few dry runs, not the day you're going to breed her, but some other time, so your goat can learn about the restraint and the speculum. And then you need to be good at observing your goats for standing heat. We're going to look at some goats in heat in just a minute. Make sure all your equipment is warm and ready to use. You might take a look at our equipment video. Shows all the equipment and some ways to get ready. So when you're ready to do it, you need to catch and restrain your goat. You want to get the speculum and look at the cervical mucus for the proper insemination consistency, which if you watched the earlier part of this video, Jim did a really good job explaining. And then when you're ready to go and you're sure everything's correct, you can load your insemination gun. You can also see how to do that on the equipment video. And then, because once the semen is thawed and loaded, you'll have only a few minutes to get it into the goat before it expires. So organization is essential. Let's take a look at goats in heat. So fortunately, goats are pretty dramatic, and so it's fairly easy to tell when they're in heat. They do a lot of tail wagging, they make a lot of noise, a lot of blatting. They do a lot of walking around and like swinging their head at each other. They might even do a little head butting and rearing up. Usually their vulva is pink. Sometimes it's swollen. Usually there's a little mucus, like sticky mucus on their tail. And they do urinate a lot, especially if the buck is around or you use a buck rag. So what is a buck rag? Well, a buck rag is like a bandana or a piece of towel that somebody has rubbed all over a stinky buck during mating season. And then if most of you that have goats know that bucks have a pretty good aroma at that time of year. So if you rub this fabric all over the buck and then put it in an enclosed jar, you can then use this rag to tell if your goats are in heat. And if you open that buck rag near the goats, you'll get a response if they're in heat. If you have a buck, you could also walk them by the pen and watch their reaction as well. It's not always easy to tell when they're actually standing, and they're often in heat for 36, 48 hours. You want to try to find the point where they're most in heat and are most responsive to breeding. So in the first clip, we're going to show somebody inserting the speculum. But I want to remind you to have your light source ready, because you'll see in one of the clips, I forget the flashlight, which can slow you down a little bit. So you're going to put lubricant around the end of the speculum that you're going to insert. You want to goop it up on the inside too much, but around the outside and the lower edge. And then if you kind of use a downward motion with the end of the speculum on the vulva, that helps get it past the vulva and into the vagina. You want to be as comfortable as possible for the goat. If you insert the speculum part way into the vagina and then look using your light source, you should be able to spot the cervix. And when you see the cervix, you can sort of push the speculum in a little further, and the round end of the speculum will fit over the cervix. The cervix is, people describe it as a rosebud. It's a little round mound with looks like it has a hole in the middle. So let's see what we can see here. This is the first video clip, and I'm going to let the sound play from the workshop, so you hear lots of people in the background. we're using a Jorgensen speculum, and we have a flashlight that actually fits on a little arm on the speculum, so you'll see that. And you'll see me reminding this young lady not to take the semen or the AI gun out of her pocket until she actually finds the cervix. Let's see if I can get this started.
Yeah, no, I was just talking my back there. And the outline. Yeah, the outline. Okay, we have more of those, so. All right, so.
Okay, so she's now looking for the cervix, and we'll go to the next clip. You notice the goat's moving around quite a bit. Sometimes you don't realize how hard you're pinching their tail while you're trying to put the speculum in. I sometimes think you're making them more uncomfortable by squashing their tail than you are by putting in the speculum. So be careful to handle the goat gently and firmly, and we'll see if we can take a look here. This is Rene Delou. He was helping teach the workshop. And normally it wouldn't be great to be AI and goats in such a sort of rowdy atmosphere. Fortunately, our goats are pretty used to a lot of people, but also we were doing a big workshop. So she's going to be, we have a little trouble with the flashlight, but she's going to be looking for the cervix here. There we go. So now she's inserting the insemination gun. And the flashlight isn't working. This is what happens when a lot of mucus and liquid from washing the speculum runs down on your flashlight. You can see her trying to look through the speculum, find the cervix. She's going to put the end of the AI gun right in the little dot in the middle of the cervix. There's like a small opening. Let's see if we can find the next one. Here she is. And you'll hear us talking about feeling for the pop. That's when you have your AI gun in the cervix, in the end of the cervix, and you're wiggling it around, and it suddenly advances like 1/4 inch to a 1/2 inch. You can definitely feel it kind of let go and go in. And that's just in the first ring. Ideally, you can get through a couple. I think in this one, we were successful in getting it through one pop.
Just go right up to it. Okay, then apply some pressure. Kind of twist it a little bit, roll it around. Gentle pressure. There you go. You feel a pop. Okay, maybe another pop. Gently put pressure on it. You'll be all right. Just don't pull back when you're doing it. Continue forward. Okay, can you go for another one?
Well, actually, she really did. That's why.
Can you go any more than you deposit? 1, 2, 5.
Searching for lamb.
Continue. Push. 3, 4, 5. Finish it up. There you go. All right. Is there another one?
There will be, I gotta go wash this though.
So there you could see her slowly push the plunger and take the AI gun out. I would normally slide the speculum out a little bit first and then take out the AI gun. So this one I'm going to turn the sound off on and just narrate it as we go. Unfortunately, there's a spot in the middle where I forget the flashlight, but I'll tell you what's happening as we go. So this is a young white Sonnencross, and that's me trying to put the speculum in. And once it goes in the opening, it goes in pretty easily. You notice I have nice handling restraining facilities there, and I have someone helping me hold the goat and talk to her. And we probably gave her a little bit of grain as a bribe. Here I realize I don't have my flashlight, so Eric Barr, who's helping me, will help keep things in place while I run and get the flashlight. So it's not that far away, but it's always good to have your lab area not too far from where you're trying to do the AI. So if you do forget something, you can go get it, or even just when you have to bring everything out, it doesn't get cold. And you'll notice we're wearing more clothes in this picture than we were before because it's quite a bit colder out. So normally I would put the flashlight, the lube, the AI gun goes in the front of my coveralls, but the other stuff I put in my pocket so the lubricant is warm when I put it on. And also the speculum, so you're not putting a cold speculum in the goat. We want to make it as comfortable as we can. So I just ran in to get the flashlight. There's a picture of the flashlight. It has a special end on it that fits on that adapter on the Jorgensen speculum. And now I can try to find the cervix. And because we're filming this for a student that's not there that day, we're going to take a minute and try to get a picture in the speculum. Now, it's quite challenging because you're not at an easy angle. You saw I pulled the chair up there so I could kneel on that. And you're kind of looking up, and sometimes the cervix is also sort of tilted up. So getting your AI gun into the end of the cervix is sometimes a challenge. And then if you're wearing bifocals, that just adds to the challenge. She's going to try to get a little picture of the cervix. So you can't see it very clearly, but you can sort of tell that the speculum is around a small mound of flesh there. So then I'm looking, trying to make sure I'm still on the cervix. Lost my flashlight for a minute. That happens too. And we have other light sources that you probably saw earlier in the video where they go inside the speculum. I feel like this gives you more view. Yeah, I'm sort of having the AI gun out of the warm place for quite a while. That's not ideal. Must have lost the cervix there. It's hard to anticipate what's going to happen as you do it. There's so many moving parts between the semen handling, the goat handling, the speculum, the light, getting everything to coordinate when you want it to, having the help there, having the mucus be just right. So now I'm in there, I'm on the end of the cervix, and I'm sort of wiggling the AI gun around, trying to pop it through. When I think I've gotten it in a little bit, I will push the plunger. I'm not looking anymore because hopefully I've got the end of the AI gun seated in the cervix. You can see she's moving around quite a bit. So now I'm going to plunge slowly. That's pushing the semen into the vagina of the goat. I'm going to slide the speculum out a little bit and then remove the AI gun. There we go. And you will save that little straw that's inside your semen gun, your AI gun, so that you can remember who you bred her with and go write it down. So I guess it's appropriate to end with a picture of the back end of a goat. And I wish you good luck. Don't give up if it doesn't work the first time. Make sure you do have a backup plan. There's a lot of potential for improving your genetics with AI. If you can find somebody who's experienced to teach you, that'll help. try to take a class or a workshop, and be sure to watch our 11 videos on goat AI. Thank you very much.